For a British junior doctor like Ashley Macklin-Doherty, free time away from work is rare and far from relaxing. She's a cancer specialist with a young child at home, and she's currently struggling to pay her bills in Britain's capital, also its most expensive city.
When I'm waking up at 2 in the morning, worried about the patient that I've just given chemotherapy to, I want to also feel like I don't have to also wake up worrying about the credit card bills and the gas bills and the energy, the things that everyone else is worrying about as well.
Protect the NHS!
Thanks in part to these financial pressures, she's joining tens of thousands of other doctors in strike action that starts today. It's the second such strike this year, with the medical union that represents young doctors demanding a 35% pay rise from the government after years of below-inflation wage increases. Macklin-Doherty says due to the government's spending choices, UK healthcare is like a sinking ship.
If you're in a system where the walls are crumbling around you, which I think is very much linked to pay cuts, you then get to a kind of critical point where you have to either stand up for what you believe in, or you just accept and leave.
Such stress has driven thousands of British doctors out of the profession or into depression, with some even considering suicide, according to Zaid Al-Najjar.
They struggle more than they used to, mainly due to the lack of resources now and the conditions under which they have to work, and that's been exacerbated by the pandemic.
Al-Najjar is the medical director of an organisation that treats doctors with mental health difficulties and says many of their problems are systemic, given reduced resources and staff shortages.
A lot of it is due to excessive workload, working conditions, worry about making errors, worries about causing harm, worry about not being able to provide what it is that you felt you could provide going into the profession.
Burnout rates in British medicine were high before the pandemic, the pressures now driving them even higher. Many doctors feel strike action is the only remaining recourse to help the public and politicians realise these problems are real and require rapid resolutions. Willem, Marx, Jazeera, London.